Peter Block here in Orlando at the AHA annual meeting for On the Scene. With me is an old friend, Joseph Rodescabot from Quebec. He and I have bumped into each other a number of times over many years, particularly over ASD closure and what is the right thing to do and when to do it. And now we have a new trial. Joseph, I'm not going to tell anyone about the trial, I'll let you do that. So what was your trial about?
Our trial, and this is important, was to evaluate the efficacy of clopidogrel on preventing new-onset migraine headaches after transcatheter ASD closure. It is important to understand that this was not about the indication, the appropriateness of the indication of ASD closure was about patients without a history of migraines that could have these effect, new onset migraines following an ASD closure and trying to prevent it.
So you actually set these patients up as having either aspirin alone or aspirin and clopidogrel. And again, this has nothing to do with trying to treat migraines with ASD closures. This is just, they had an ASD closure, then what happened to them with these two antiplatelet therapies? What'd you find?
We found that clopidogrel, in addition to aspirin, reduced significantly the rate of new onset migraine headaches and the burden, the global burden, the mean number of migraine headaches within the 3 months following the procedure.
So this raises an interesting question about the whole business of migraines, doesn't it? Because maybe migraines are related to small thromboemboli, whatever you want to call it, that have to do with, which are treated with dual antiplatelet therapy. Would you agree?
I would agree. I think that migraine is a very complex field. But we can say in this, from this trial that with a specific trigger and in a specific groups of patients, a prothrombotic status might be an important trigger of these migraines, and in some of these patients this can be prevented with a dual antiplatelet therapy.
So let me ask you a question, Joseph. If you had an ASD and I closed it for you, and all went well, what would you want to have going forward? You don't have migraines. Would you want to have dual antiplatelet therapy, or would you start with aspirin and then add clopidogrel if you started getting headaches?
I could go with dual antiplatelet therapy from the beginning because the majority of these migraine headaches appear within the few days following the procedure. And I think that with this trial we showed that really you can decrease this secondary effect by adding clopidogrel to aspirin.
Okay, so an important clinical point here that if you have an ASD closure, then dual antiplatelet therapy is the way to go starting out. We've all given aspirin all the time, and maybe now we should change our thoughts about that. Maybe we are decreasing migraine going forward, but it also raises a lot of questions about the very complex migraine field, doesn't it?
For sure.
Thanks, Joseph.
Thank you.